Okay, this video is who are the stupidest patients? Well, first of all, the stupidest, like the dumbest patients that aren't demented, frankly demented, would be the kidney failure patients. And for multiple reasons, disrupted calcium metabolism in the blood, parathyroid, hormone, other reasons. It's very atherogenic to have kidney failure. And they calcify all their external carotid artery branches. They calcify their internal carotid artery, the arteries going into the brain. So they drop the blood supply to their brains. And they're also carrying on board a bunch of uremic toxins that can impair cognitive function. Ammonia is toxic to the brain too. So anyways, these poor patients, they tend to be rather stupid. Okay, next one is obstructive sleep apnea. And these patients also rather stupid. Obstructive sleep apnea goes hand in hand with obesity, hypertension, and diabetes. Their brains are hypoxic at night when they stop breathing and they can't move air down into their lungs, and that makes people stupid. It's not just their daytime sleepiness; they're also rather stupid. And again, what should they do? Go low-fat vegan and lose the weight and have a good chance to cure oneself. IV drug addicts, anybody who would choose to waste the one life given to them by God to inject drugs into their vein is an idiot. Like Ayn Rand had said, a man who has a good goal for his life, he doesn't want to damage himself with drugs or other stupid behavior like that. Alcoholics are, incredibly stupid. Why would you want to drink a neurotoxin and shrivel up and pickle your brain, make it all shrunken and atrophic? It's stupid. Marijuana smokers, they're a weird group. They think they're clever. They think they're getting away with something. They think that they're the ones who are on to the truth. But they're just notoriously stupid. I always try to get out of the room as fast as I can when I talk to one of them. It's so annoying how they think they're smart while they're destroying themselves, burning holes in their lung, damaging their brain. I work with neurologists. I talk to them all the time about how terrible marijuana is for the brain. It can also cause schizophrenic breakdowns. It can be laced with PCP, etc. It's a bad drug. Diabetics, they're usually cognitively impaired by 60 or much sooner than that. 99% of these dummies will choose pills over diet. Type 2 diabetes, it's easy to cure with diet. Become a low-fat vegan, lose the weight, optimize your blood flow, avoid your insulin resistance by avoiding the fat and the other things. I just did a newsletter recently on how you avoiding the causes of insulin resistance, which also includes get your sleep, don't drink caffeine, try to manage your stress. Coronary artery disease patients, 99% of these dummies choose stents and surgery, CABG, CABG, coronary artery bypass graft over diet. The cure rate for Esselstyn diet for coronary artery disease is 100% with no side effects. It improves your health versus, stents and surgery for cardiac angina patient. They don't even increase longevity. Stupid. Dr. McDougall has lectures on that. Okay, sad diet eaters, which is, almost all Americans. Almost all of them end up being hypertensive, either diabetic or hypertensive or both. And typically they choose pills over diet and they're cognitively impaired. When I say cognitively impaired, I don't mean quite totally frankly demented, I mean that they've lost their capacity for nuance, for any type of subtle thought or discourse, so they can still find their way home, but they're no longer going to do or say anything interesting with their lives. And also their disease tends to become irreversible because once they've lost that inner energy and mental curiosity and zip that a smart, healthy person has, they're not going to turn their disease around. You never see that. You just see them keep rolling downhill and into destruction. They never get out of the pit of doom. Let's see, what else? Hypertension is the number one risk factor for stroke. So anyways, I realized this was a little bit of a downer, but it's important to realize what you want to avoid. Don't worry about Alzheimer's. Alzheimer's is sort of a, there is like a genetic familial Alzheimer's, but in terms of sporadic Alzheimer's, which they claim is the most common cause of dementia, that's actually nonsense. And that's not what gets most people. What gets most people is this stuff. Like I said, I got internal medicine friends tell me every single one of the patients 60 and older is cognitively impaired. And in my personal experience, that's mostly true. I'll occasionally see an exception to that. I myself am 61 years of age, but in general, it is true. If somebody tells me the patient is 60 years old, I don't even look in the chart, and I have to go do a procedure on them. Of course, I'd like to look in the chart, write my pre-procedure note. But what I'm saying is, if they just show me a film and say this patient's 60 years old, I wouldn't look in the chart. I would just automatically assume the patient's overweight, hypertensive, and diabetic. That's a safe assumption. Anyways, I hope this was helpful.